That's your new computer lab. Yes.
Oh, I know I love the windows. The window.
Yes. No more loving about
Let's go.
Yeah, so 4 stations here. You can see all of the piped in air, oxygen that we'll have, so we can have 4 different patient care areas in that region. A lot of storage, you know, all of our supplies.
This is kind of learning space. This is practice space.
Yeah.
We will have simulated mannequins in here that can breathe and have heart rates and respiratory. Yeah, we are.
Oh, so it's going to be simulated pictures.
So we are. We're going to have some more simulated mannequins here too, as well as in the sim space. We have all the gases coming through here, so we can present those. You know, we can show the ventilators. We get a ventilator to be up on the screen, so you can see what the ventilator looks like. So I really love how it's separate but still together.
Yes.
Right.
You'll have multiple like oxygen air access, so you guys will be in these first 2 bays.
Wow.
And then nursing will be back here.
This is so great. This is huge. And
You can't even see on the other side.
And then the monitors will go.
Yep, monitor, yeah.
Okay.
So the bed will be set up just like it was before. You'll have both sides that you can, you know, work around, and then your monitor will probably be right over here.
Wow.
And then, like I said, some of our existing simulators will come over, and then some of them will be brand new.
And the difference is with these, they actually have active air in them.
Yes,
So now,
yes,
instead of just
so- yes, so
pretend
when
you're
you-
turning it up to
So
zero.
when you turn on the oxygen, it'll actually fluctuate. Yep, yep, yep.
Oh yeah, that's right. Right. But everywhere where there's a head wall, there will be a bed there. 2, 4, 6, I think. 6 in here.
Oh yes, but there's more.
Oh, wait, there's more.
Hold on, there's more. So we'll open those doors and we can expand practice when class doesn't need to be expanded over here. Because again, this will be 3 beds. You know, these doors can be closed. We'll put a sign up. But then we also have 3 checkout rooms. Yeah.
So like for instance, if first semester's doing their lab here, second semester could come in, practice
Correct.
their skills.
Before they do a check.
Correct. And then
That's
checkouts will be right in here. Yeah. But yeah, so this will be the skills lab.
That'd be nice because I feel like I do about 60% of my tutoring revolves around skills.
Yes.
Yep.
It goes back outside.
Yep. So it's just kind of one big loop. Yep. It's just one big loop
The
around.
whole thing's connected.
Yep.
These basic simulation rooms, they're all designed for as much visibility from students to even bystanders. That's why we got the large windows.
But this is where the ambulance is going to sit. Back will be back there. The side door will be here.
The main differences with this lab is it's got its own built-in classroom. We can do classroom, we can go to breakout rooms, and then we can also do all of our lab stuff here. Monitors there, monitors in the back, and so the students should be able to, wherever they're sitting, be able to view.
Are these
These are breakout
debrief
rooms.
rooms? Okay. Okay.
We call
get a
breakout
small,
rooms, or
yeah, they're
not
small
debrief
groups.
rooms.
Okay.
Small groups.
Okay.
Breakout, you know, we tend to do small stations, so usually 5 to 6 students in a station.
This is the simulation room. It'll have the driving simulator in it. Also in this room will be our high fidelity simulation mannequins.
Is it like an actual driving?
Yep.
Oh, wow.
The only thing that I wish it was like a VR. It's not a VR.
Okay.
But you're still going to be able to sit at it, and you know, traffic will go by you, and things will happen while you're driving. So there'll be a gas pedal, and you actually drive.
So how do you feel now that you're in the new space?
I'm excited. I'm really excited to have a space big enough to hold everybody because we have a lot bigger classes in the last couple of years. We're averaging 40 students in a medic class or even an EMT class. And I think it's really important that we have a space where we can all come together and practice together and have a legit setting like this, like a house style, because we do clinicals and all that, but it's important to practice and have this kind of setting and work as if it was a real job or like a real call. So I'm very excited to have this space and get to work with everybody.
We're kind of squished together right now with the bachelor's program at the other facility. So I'm excited that we have this to kind of expand, and I'm just excited to see the future.
Love it. I think it's wonderful and everything is new. I love the windows. I love looking out the window. It just helps when you're learning and like to take a break and stuff, like a mental break. So it's beautiful in here.
What are you most excited about in the new space?
This new lab area
they've expanded it, but then they've also made it very easy for like multiple classes to utilize this area. Sometimes when lab's going on and then you have one-on-one with another student to try and get them ready, like their skills ready, it's hard to do with a class going on. And now that we have this like separate area, it'll definitely make that a lot easier.
This is really amazing. Being able to move in the new space with them, I know they're in ready for a surprise for real. Yeah.
What were you most surprised by, you think?
I think the sim lab and like the checkout rooms, I like that. They're really spacious, and you can tell like they really kept in very minute details. Overall, I'm really excited about this. I can't wait for January. Hey!